Hello. Many times couples, they do ask me a question when they get the report of very low AMH or low AMH. So first of all, I'll tell you what is AMH. AMH is an anti-Mullerian hormone which tells us that how many eggs are there in your ovaries. It gives us an idea about the ovarian reserve of your ovaries. We have to understand one important thing here, that every female has a fixed ovarian reserve, and with age that reserve decreases. So when the female's age is around 25, she has very good ovarian reserve, but when her age increases and it goes above 35, the ovarian reserve declines very sharply. But the patients who wants to conceive, they are worried, and they get worried by seeing the report of low AMH. And what are the options for them? So whenever we get any report with the low AMH, first of all, we give few treatments to the patient. We give some multivitamins, some lifestyle changes, and few mild hormones to the patient to increase the AMH. In few of our patients, the AMH increases by some level, so that we can retrieve 3 or 4 eggs or maybe 5 eggs, and we can have 2 good embryos to give you pregnancy. So after giving you medications for 1 or 2 months, the AMH test is repeated. And when we have to decide about the IVF, the 2 options are given to the patient. When the patient is of younger age group, that is from 25 years to 35 years, then we always suggest patient to first go for self eggs and to see the results of that IVF cycle. And then the pooling of the eggs, that means 1 or 2 IVF cycles of that patient can be done. Eggs can be collected, and any number of embryos which are formed from those 2 cycles are transferred to the uterus. Because here we have to understand, with the lesser age group, the success rate of IVF is more and the quality of the egg is better, so the quality of the embryo is also better. But once your age crosses 35 years and it is between 35 to 45 years, then the quality of the egg decreases and the embryo quality also decreases. And the next thing is that the chromosomal abnormalities, the chances of having any chromosomal abnormality increases after the age of 35, and after the age of 40 years it increases drastically. So in these patients, can we not try this self IVF? Definitely we can try self IVF even if there is low AMH, but that will be a trial cycle. We can give you some medications, we can use some protocols to retrieve your eggs, and when the embryos are formed, the embryos are sent for the genetical testing to check for any chromosomal abnormality. And if that embryo is good and having no chromosomal abnormality, that embryo is good to transfer inside the uterus. So it is not the case that with very low AMH, we can never try IVF cycle. But as a couple, you have to understand that with low AMH, the probability of retrieving eggs from your ovary is very less. To make embryos out of those eggs are very less, and in turn the success rate is on the lesser side. But it does not say that we cannot try. We can definitely try. Thank you.